Hi, I'm Patrick and I'm from the Salford Chiropractic Clinic, and today I want to talk to you about plantar fasciitis and foot pain. Many of us may have heard about plantar fasciitis, but what actually is it? The fascia is tough tissue that goes along the bottom of the foot, and when this breaks down it can be painful. Often people will notice that they get pain along the base of the heel or pain into the bottom of the foot. This pain is normally worse first thing in the morning as soon as you put the foot down, or worse as you're walking, especially after any periods of immobility. This pain is normally limited to the base of the foot. Once the fascia has started to break down, it can be extremely debilitating in terms of the pain and also limiting in terms of movement. Quite often, when plantar fasciitis becomes chronic, i.e. if it's there for a long time, it can be very difficult to get rid of. But not all foot pain is plantar fasciitis. But how can you find out whether you might have plantar fasciitis? A quick way of identifying it is by placing your foot onto the floor, lifting it up from the front and seeing if you have any pain across the heel or the base of the foot. Additionally, you can use your thumb to push into the heel. Normally in plantar fasciitis cases this is very tender, and around 50% of people notice that that's the epicenter of the pain. Additionally, as I mentioned before, you tend to notice that the pain at the bottom of the foot is worse first thing in the morning or when you've been sat down for any period of time and start to move again. As chiropractors, we treat plantar fasciitis by addressing the soft tissue at the base of the foot, by making sure that the joints in the foot all work as they should do and that there's no restriction in them, and also making sure that the nerve supply to the foot and the muscles within the foot are working as they should. So how can you help try and treat this yourself at home? An easy way to do this is by trying to use an old plastic bottle, one like this with the small feet on the bottom. You want to place the bottle on the floor on its side and putting your foot over these little feet at the base of the bottle, roll it forwards and backwards for about 1 to 2 minutes, once or twice a day. This helps release some of the tissue underneath the foot and the musculature and help relieve the pain. This is a complementary treatment to things that I ask patients to do at the clinic. But what happens if your pain in the foot isn't plantar fasciitis? As I mentioned before, plantar fasciitis affects the bottom of the foot, but often we see patients with pain at the top or the sides of the feet. There's a variety of different reasons that this can be caused. For example, a nerve can be irritated up in the back or down at the side of the foot. Tarsal tunnel syndrome is one that we commonly hear about, and it's similar to carpal tunnel, but in the foot. Additionally, these bones that normally articulate quite freely in the foot can become fixed. This often leads to pain, swelling and tenderness in the area locally. As chiropractors, we're trained to identify these restrictions and treat them accordingly. Oftentimes, the pains that we see at the top of the feet don't come from the feet at all, but from nerves higher up the leg or into the back. A good way of trying to test this is by lying on your back, keeping your leg straight and pulling it up and seeing if you get pain in the foot. This adds tension to the nerve, and if it aggravates the pain, it's probably coming from there. As with most local injuries to extremities, the best protocol is always RICE: rest, ice, compression and elevation, especially if you've noticed that the pain's come on recently. We hope you found the information in this video helpful. If you know anyone that may benefit from this, feel free to tag them below, and if you've got any questions, comment below and we'll get back to you when we can. Thank you for watching.